We're joined by Bill Korn, CFO of medical billing company MTBC, celebrating the company's 5-year IPO anniversary right here at the NASDAQ. We'll watch for you ringing the closing bell today.
Thanks.
First
it's great
of all,
to be here.
We're so happy to have you. First of all, there's 2 stocks to follow, MTBC and then P on the end if you want to look at the preferred, the common and the preferred. Did you have any thoughts on one versus the other?
Sure. So we went public 5 years ago with our common stock, and the common stock clearly has the opportunity for lots of growth. At least we in management think it does. But as we've grown and we've done a lot of small acquisitions over the years, we've done some of the financing by selling a non-convertible preferred. And so the advantage of that is if you're on a fixed income and you like the idea of a monthly dividend payment in cash, the preferred is great for you. It's not convertible, so you're never going to get the home run. But in some ways, that provides the advantage for the common shareholders because the common shareholders could focus on the growth and the preferred shareholders could focus on income.
So tell us about MTBC when we talk about technology in the healthcare industry. I mean, what is so innovative about the company right now?
Sure. So MTBC is a healthcare IT company. We've developed a fully integrated platform. So it covers everything from the electronic health record that your doctor uses to take notes when they're seeing you, to the practice management system that the receptionists would use to schedule appointments, check insurance eligibility. And that's bundled along with what's called revenue cycle management or medical billing, meaning we submit the claims to insurance, we argue on the doctor's behalf to make sure that it gets paid, and we pay for the whole thing by having customers give us a % of the total amount that they actually collect.
It's pretty amazing because you've been growing certainly through acquisitions. I saw you've completed 14 acquisitions since the IPO, and you still have room. You still have room for more this year, right?
Absolutely. So I think we see a couple avenues for growth. Our largest client is actually one that didn't come through an acquisition. It's one that we signed up a year and a half ago. They were big at the time. They've grown a lot. And again, since we're billing a percentage of what they collect, as they grow, we get the benefits of that growth.
What client is that?
So it's Fox Rehabilitation. We've talked about them, so there's been some press on them.
Do you have any acquisitions in the works right now?
So we have nothing that we're ready to talk about at the moment.
Okay.
And I'd say we're always very careful with acquisitions. We tend to get an idea of what we think something is worth, and if we can't close the deal on those terms, then we're very patient.
Both your stocks, by the way, are steady eddies, right? You're up to year to date, but you don't have the wild volatility of some of these tech type stocks that might go crazy. When we talk about what you're doing, right? A lot less typing and filing for these doctors using your technology. I mean, this goes into AI and blockchain. I mean, explain that a little more so people understand why this is the way to go.
Sure. So our current generation of electronic health record software is called Talk EHR. And as the name implies, if the doctor wants, they can talk to it.
Right.
It's got artificial intelligence and therefore can try to predict things and give some hints to the doctor as to what should they be focused on.
Right. Electronic health records. It's amazing how the doctor can just get it all. They spend so much time doing all these filing and writing notes and everything. What about security, cybersecurity? My personal information that could be compromised.
Yep. So that's one of the number one things that we focus on.
Sure.
is the security. Encryption, making sure that things are very well protected. So we've got a team of 350 people devoted to our technology, offshore for the most part. The data sits here in the U.S., but we're able to afford a lot of people working at how to make it safe because we're able to leverage our own employees at lower cost than if we had those 350 technology people here. It would be a little harder. And so we're never tempted to cut corners. We're always looking at how to do it the right way.
I know in your background you were part of IBM. I mean, you're a tech expert and financial expert as well. I mean, IBM acquired Red Hat, right? A $34 billion deal, which boosted the hybrid cloud platform for the company. Did you have some thoughts on that? What should people think of that? Was that a good deal?
So without knowing all the specifics of the
Right.
deal, from what I've heard, it sounds like a good deal. When I was at IBM, back in the 80s and 90s, the company was really making the transition from selling hardware into software and services.
Right.
So I was actually part of the team that created a service business, and people at times were thinking, what's the future of technology? And I think by now the answer is the future is really more service oriented than it is selling boxes. And
right.
so I think that's true for IBM. I think it's also true in our case as well.
In what you're doing. Yeah. All right. Well, we'll see you later for the closing bell. CFO of MTBC, Bill Korn, thank you for joining us
Thank you.
on the show.